So, good evening, everyone. Thank you for joining us on World No Tobacco Day, year 2025. So, every year on this date, uh, efforts are made throughout the world to dissuade people from using tobacco because, as of now, tobacco is the most common cause of cancer and it's major cause of cancer mortality. Although majority of the people who use tobacco, they are also aware that tobacco is something which is not good and usage of tobacco is a risky behavior. Still, the usage of tobacco is increasing year by year. So that's why it's essential to reiterate this message that tobacco consumption should be avoided, should not be started, should be stopped, so that we can reduce the risk of many of the diseases which are coming because of tobacco to us. I'm Dr. Devendra Pal. I'm a cancer physician at MOC, Mumbai Onco Care Center, Vashi and Panvel. So I'll be proceeding with this discussion forward. So my agenda is very clear. So I want this message to percolate that there should not be any smoking. There should not be. It should not be. The entire world rather should be a no smoking zone, because this is something which is the most dangerous self harm which we can do with smoking. So, just to give you a background, like we are staying in a the most populous country, India, Bharat. So we are very proud of it. It is one of the most fastest growing economies. About 70% of Indians are below 35. So that means the population which is capable of working and increasing the GDP is very large. So that's why our GDP is increasing, and we are the fourth in the number of GDPs, world GDP, largest GDPs. And there's tremendous diversity from Kashmir to Kanyakumari, from Gujarat to Northeast. So our population is quite diverse. Our habits are different. Our diet is different. Our genetic pattern also is not same. We are the largest democracy. We are proving it every now and then. And we are a very confident and aspiring nation. So we are increasing our presence felt in all the quarters, whether it be sports, space, science, computers, food sector. So we are doing wonderful. But what we don't know, or we may know but not giving too much attention, is that we are the world's second largest tobacco consuming country of the world. Number one is China. So we have more than 275 million tobacco users in India. And this tobacco use is increasing. 35% of our people, our population is using tobacco in some form or the other. And usage is more in men as compared to the women. Because of this, tobacco use kills about 1 million Indians a year. And tobacco is the deaths because of tobacco are the fastest increasing trend. About 1 million people in India die because of tobacco, just tobacco. More than 8 to 9 lakh Indians die every year due to tobacco-related diseases. 8 to 9 lakh means around 1 million. So all these deaths are preventable because no one forces tobacco on anyone. So it is self-inflicted harm. So these deaths are preventable, and smoking is responsible for about 1 in 20 deaths in women and 1 in 5 deaths in men, because tobacco consumption is much higher in men as compared to women. In Western countries, this data is little different because there women also are smoking in large numbers. So, but in India, because smoking is more in men as compared to women, but nonetheless, smoking in ladies, in women, is increasing, especially in younger women. Women in college or teenage girls. So we see large number of young girls, women smoking, and this habit, once formed, is difficult to get rid of. So we can see, we can expect in another, you can say 5 to 10 years, the number of smokers in women in India it may double in next 10 years. If we don't dissuade this habit of starting the habit of smoking. So 70% of people who die of tobacco in India are usually between 30 to 69. That means these are the people who are the earning members of the society. So this is the number of deaths, and before death, there's a lot of financial constraints because of the disease, lot of expenditure, lot of physical and psychological trauma. So these people in most productive years of their life, when they start earning, the person usually starts earning from 21 to 30 years of age. And many times tobacco usage starts in teenage or early adult age. So by the time they start earning, they are affected by diseases which are because of tobacco consumption. So this is a very pathetic situation, and we need to overcome this. So in nutshell, smoking or using tobacco is nothing less than a suicide, because it is not inflicted on anyone. The person starts smoking on his or her own and continues this habit despite knowing that this can be lethal. But unfortunately, people think that nothing will happen to me. It can happen to anyone else, but it cannot do any harm to me. It is just for fun. I'm just doing it for, I'm not heavy smoker. I'm smoking just small number of cigarettes or BDs per day, or consuming tobacco once in a while. But this habit usually keeps on increasing, and it's difficult to end this once you are habituated to it, because tobacco is highly addictive. Once you become addict of tobacco, then it is very difficult to leave this habit and be a non-smoker or non-tobacco user. So best is to not to start the habit as such. So how is tobacco used? So we are all aware this tobacco is used in all these forms. So we can divide it in two forms: smoked and non-smoked tobaccos. In smoked tobaccos, cigarettes are there, BDs are there. In India, hookahs are there. And many people believe that BD is less dangerous than cigarettes, and hookah is not dangerous, hookah is safe. But it is not like this. Tobacco consumption in any form is dangerous. It can cause all the diseases which tobacco can cause. So no form of tobacco is safe. And on top of that, we are unique that we in India only we use pan masalas and gutka and all those things which are not used anywhere in the world. And we have our role models who promote the use of gutkas and pan masalas. We have big film stars who are promoting use of this uh, chewed tobaccos. Rather, they should be promoting not to use the tobacco, but unfortunately, they are promoting its use. So, if you divide this smoked and non-smoked tobacco in Indian users, about 34.6% population is tobacco user, and around two-thirds, 66% around, is non-user. Out of this 34.6%, 8.7% only smoke, 5.3% smoke and chew tobacco both, and around 21% they use only smokeless tobacco or chewing tobacco, gutka, pan masala, or khani. So chewed tobacco is much more prevalent in India. The components, there it's proven that there are more than 4,000 poisonous substances in tobacco, and these dangerous substances can cause various diseases, not only cancers, but they can affect any part of the body. And to name a few, they can cause hair loss, It can cause cataract in the eye, and they can increase the tooth decay because the local immunity is reduced. They can cause lung cancer. 85% of lung cancers are caused because of tobacco as of today. If we stop the use of tobacco, lung cancer's incidence will be reduced to less than 85%. Heart diseases risk is increased. Stomach ulcers risk is increased. Many times it can become cancerous ulcers also. Sometimes because of the involvement of blood vessels, it can cause gangrene, discolored fingers, deformed sperm, fertility can be reduced. And all this, if continued for long duration, leads to a painful death. So it's advisable, it's a request that we should motivate people to quit tobacco today only. Another slide to show, frankly, the chemicals which are most dangerous, the most poisonous substances present out of 4,000, which I told in the last slide. There are few chemicals which are most notorious. So nicotine is highly addictive. The person become addictive to tobacco because of the nicotine. We have tar in the smoked tobacco. Tar is, tar is used in making these roads. So, and it is so sticky. It has a lot of carcinogenesis potential. So tar, which is used for making roads, we are inhaling. Carbon monoxide is there in the tobacco smoke, which can reduce the oxygen carrying capacity of the blood, and it can cause difficulties because of less oxygen supplied to various parts of the body. Cadmium, which is present in the batteries, it's there, which is highly carcinogenic. Mercury is highly carcinogenic. It is there in smoked tobacco. Polonium is a radioactive substance which is there in the smoke, and definitely it's an important cause for causing cancer. Arsenic and formaldehyde, they are another two chemicals which are carcinogenic. So when you smoke, all these chemicals go in the body and do all the tamasha and all the wonders in the body in the long run. To enumerate more difficulties, more problems which can be there because of tobacco, so we can enumerate lots. So there can be cancers of various parts of the body, starting from the oral cancer, starting from the food pipe, cancer of the food pipe, which we call esophagus, cancer of the voice box, which is called larynx, cancer of the lung, leukemias, cancer of the kidney, cancer of the urinary bladder, um, cancer of the pancreas, cancer of the stomach. So these all risk of all these cancers is increased. Other than cancers, there are other diseases which risk is increased, like increasing coughing and sneezing, shortness of breath, chronic bronchitis and emphysema, which are chronic lung conditions. It can affect fertility both in men and women. The risk of stroke, brain stroke is increased. Defective vision risk is increased. Aortic aneurysm, where the blood vessel called aorta is dilated like a balloon and it can burst anytime if it persists, if it is not controlled and treated in time. There can be peripheral vascular disease and gangrene. So it can be gangrene of the lower limbs, gangrene of the toes, gangrene of the foot, gangrene of the leg. So these are quite common in people who use tobacco. This is which we see most often, but this is not only this much. It has many serious implications, which I mentioned before, because it's not only the staining of teeth. Staining of teeth may not be life-threatening, but definitely it is something which no one will like to have. But when someone becomes addicted to all this, so it's very difficult to leave. Tobacco, smoked tobacco or chewed tobacco give rise to gum ulcers, ulcers in the gum, or gingivitis, because the local immunity is reduced. Local blood supply to the gums and teeth are reduced. So this leads to gum ulcers and gingivitis. There is chronic irritative cough, mouth ulcers. So people who have been chronic tobacco users for many years, they cough more frequently, and cough is irritating. They produce a lot of phlegm and sputum. They frequently have mouth ulcers, and many times they neglect these mouth ulcers, which keep on increasing in size and later on convert into oral cancers. There is a deadly relation of tobacco with cancer. So cancer is the most dreadful disease of mankind. It is master of all the miseries, and master of miseries is because of tobacco. We are inviting the master of miseries when we are using tobacco. Oral cancers is the most common cancer, which is because of tobacco. In India, we have people which are using who are using chewed tobacco, gutka, pan masala, khani. It's being used rampantly. The use starts in the early age. Like we have seen people, children in the teenage years, they starting the usage of khani and tobacco. And in their early 20s, we have seen patients suffering from oral cancers. This is because of local irritative effects. Obviously, smoked tobacco also causes oral cancers. Before oral cancer is produced, a condition is produced in the mouth, which is called submucosal fibrosis. So normally, our mouth is very pliable, mm, very, very flexible. We can open the mouth to a large extent. We can, and those people who use this chewed tobacco, gutka, pan masalas. So what happens is this some mucosal fibrosis develop, means the layer just below the surface of the mouth, their fibrosis develops. It becomes more rigid. So mouth becomes very rigid. It's not that flexible. Mouth opening is reduced. We have seen people's mouth opening is hardly 1 centimeter. Normally, mouth opening is 5 to 6 centimeter. Normally, at least this much mouth opening is there. But those people who use this tobacco, their mouth opening is reduced, and later on it may convert into oral cancer also. People who use tobacco for long durations, mainly smoke tobacco, they have shortness of breath. Shortness of breath even in young age or middle age. So shortness of breath has many reasons why many causes are there because of what which can be there because of the smoke tobacco. So what is there in the smoke, tobacco smoke, which causes shortness of breath, and how does it damage the lung? So as I told you, cigarette smoke contains tar, which is used in making the roads. So it is a thick black colored substance. So a mixture of tar is inhaled into the lungs. It increases as cigarette use increases. So the black pigment is deposited in the lung, and the last puff of the cigarette contain more or twice of tar as compared to the initial puff. Along with the tar, this carbon monoxide is there in the tobacco smoke, which is inhaled, and it combines with the hemoglobin which is present in red blood cells, and it makes difficult for red blood cells to carry oxygen. The function of red blood cell is to carry oxygen to all the parts of the body, and carbon dioxide binds to this hemoglobin which is there in our red blood cells, and the transport of oxygen is impaired, so this leads to breathlessness. Most of the chemicals which are inhaled in the smoke, they stay in the lung, but they can go from lung to the blood and affect other parts of the body also. But the first organ of the body which is affected because of tobacco is lung. So more you inhale, longer you inhale, there's more damage to the lung. And all this leads to COPD, emphysema, bronchitis, and ultimately to cancer also. So left side is the photo of lung. Lung is the all know lung is there are two lungs situated in the chest, right and left side. Left side is the normal looking lung, and the right side is lung of a smoker. See, the lung is scarred. It's not smooth lung. Scars are there. Surface is irregular. It has become dark. So many bubbles are there in the lung. So this is a damaged lung because of tobacco use. So lung cancer continues to be the leading cause of cancer death. It is second most common cancer in men in India, and 85% of lung cancers are because of tobacco only. Worldwide, lung cancer kills over 1 million people each year. There is a strong association, as I told, 85% of lung cancers are because of tobacco. But good news is that after tobacco consumption is reduced or stopped, the risk starts decreasing. But the risk is reduces only after 5 years. But the risk doesn't become zero. But definitely after cessation, the risk of lung cancers can be reduced. So even if someone is smoking as of today, they should smoke, and in 5 years, more than 5 years, you can expect the risk to be reduced much lower as of today. After this, there are other diseases, like other common diseases because of smoke tobacco, are coronary artery disease. So we see heart attacks. Although in common language, coronary artery disease is called heart attack, where heart is affected because of the chemicals present in the tobacco. The blood vessels of the heart, blood vessels which supply to the muscles of the heart, they get narrowed. So which leads to coronary artery disease, and heart attacks are seen more commonly in younger people who are smokers as compared to who are non-smokers. This gangrene of foot and intermittent claudication. The chemicals present in the lung, mainly carbon dioxide and other chemicals, they cause changes in the blood vessels, which supply to peripheral parts of the body. So our feet are the most peripheral part. They are at most distant distance from the heart. So the blood vessels are narrowed. So if blood vessels are narrowed, blood supply to the distal parts, to the most peripheral parts of the body is reduced. Because blood supply is reduced, the cells and tissues starts dying slowly. They starts shrinking. Then say first the initial sign is change in the color, and later on they become darker and darker, and this condition is called gangrene of the foot, which is seen exclusively in people who use tobacco. So tobacco doesn't affect only the person who uses tobacco, but the family of the person who uses tobacco is also affected. So it's not only self-harm, but causing harm to the family members also. So this is called passive smoking. So they are innocent people who are not using tobacco, but they are affected by the exhaled smoke of a tobacco user. So children of smokers have more cough, more colds, they have more problems with asthma, they have more pneumonia, bronchitis, bronchiolitis, and they are more likely to be hospitalized with these conditions. So families where smoke tobacco is used, their children are more predisposed to respiratory problems. Children of smokers have more surgeries for tympanoplasty, like ear problem, tonsillectomies, and adenoidectomies. This is because of the effect of smoke on the upper airways. And babies of smokers are more likely to die of sudden infant death syndrome. Sudden infant death syndrome is a condition where a small baby is found dead without any known reason. So this is found to be more common in families who use tobacco in the family. Obviously, there are increased health expenses because of repeated illnesses, and because of health expenses, the family income and savings are used for health-related problems. And the children of the family where adults are using tobacco, they are most likely to develop this habit, and this habit percolates from one generation to the other. So this is how tobacco affects families. It not only affects immediate families, but it also affects future families. So it affects the further generations also. It is very sad to see the advertisements which promote tobacco in women. So in Western countries, this was in late 80s and early 90s. The usage of tobacco in women increased because of advertising which promoted the usage of tobacco in women. So this affected the health of women, reproductive health of the woman, and the fertility is reduced. Women who smoke, they have delayed in conception. It's difficult for them to conceive a child. They have 30% higher risk of being infertile. And the risk of abortions is increased in those women who smoke. It's not only reduced fertility, but the babies which are born to the women who smoke, they also have a lot of problems. So they are at high risk of being born prematurely, means before the term. So they are born when they are not fully grown up. They are expelled unnaturally from the body because of the effects of tobacco. Their birth weight is low. The risk of death because of all this is increased in these babies. In men also, the tobacco reduces the sperm count. So fertility is reduced in men also who use tobacco excessively. So my request is we should choose life and not tobacco. Quit tobacco, enter a new world of good health. So what are the benefits of quitting? When you stop using tobacco, your heart rate and blood pressure starts dropping to normal. This is the first benefit, one of the first benefits of tobacco quitting. The heart rate and blood pressure drops to normal. So many people who have been hypertensive, they have been using medicines for high blood pressure. Their blood pressure comes back to normal after they stop using tobacco. Carbon monoxide level in blood drops to normal. When carbon dioxide monoxide level drops, so the breathlessness is and irritation sometimes, which is the chronic irritation, that is reduced. And blood supply is increased. Lung function is improved. Coughing reduces. Shortness of breath reduces. And over long term, the risk of stroke decreases. And in further long term, the risk of cancers of the mouth, throat, esophagus, cervix, bladder, and pancreas, it reduces. So these are the benefits of quitting tobacco. So we request all people, everyone who is using tobacco to stop it from today and demotivate people from getting this habit. But how to quit? Sometimes it's difficult. Some people want to quit, but they can't quit. So they devise methods. So many times they think that I'm smoking one packet, so I'll reduce one cigarette per day. So in maybe 10 days or 20 days, my smoking will stop. Reducing to 4 per day or 1 per day. So this usually doesn't happen like this. The tapering phenomena is never successful. If you have to quit smoking, you have to quit smoking upfront, once for all. You decide that you have to smoke, you have to stop smoking tobacco use, you have to quit, and it should start. It should start immediately. There should not be any tapering. So these are the tips how you can quit smoking. So first you have to make a promise to yourself, decide a date. I'll stop smoking from tomorrow. Be confident of yourself that I will do it. Remove all the tobacco products which are present in your home, office, or surroundings. Drink lots of water, keep yourself engaged, and take help from healthcare providers. Now we have medicines also, which can be used to come out of this addiction. We have now counselors are available, can help you to come out of this habit. Government has made many tobacco control laws, but still many of them are difficult to implement. The sale of tobacco to minors is banned. The sale of tobacco within 100 yards of educational institutions is banned. But we see this going on rampantly. Smoking in public places is banned. So luckily, although in buses we may say sometimes people smoking, but that is also reducing nowadays. But there are no smoking zones where we see no one is smoking, like metros, airports. No one is smoking. In airports, they have made smoking rooms, but outside those smoking rooms, no one is smoking. Advertising for tobacco products has been banned. So tobacco advertisements are not there. So it doesn't motivate people. So these laws are there, but still usage of tobacco is quite rampant. So quitting smoking is obviously is something which is very logical. I think listening to all this, there should not be any doubt that we should all who are using tobacco should stop this habit and quit smoking. There are some common myths related to smoking. So many times people feel that smoking is just a habit, I can leave it any day. But as I told, the smoke contains, tobacco contains a chemical called nicotine, which is highly addictive. Sometimes it becomes difficult to come out of the addiction, and this addiction can be overcome not only by one willpower. Obviously, willpower is most important thing to overcome this habit. But many times, willpower is not enough, and we may need help of counselors, help of some drugs which are available. So sometimes it is required. Third myth is that if people have tried quitting many times, it becomes difficult. So the more failures decrease the chances of quitting. So it is not like this. If you have failed to quit, or if you have tried to quit but could not quit till now, is always next time. It's always better to move ahead with a stronger resolve to quit smoking. Quitting is expensive, but smoking is further more expensive. So what is our medical professionals' experience regarding tobacco? So tobacco use is increasing mainly in young people, and we are seeing more young people dying because of cancers, lung cancers, oral cancers. The numbers are increasing because of the tobacco use. The incidence related to heart problems is also increasing. We see many people dying at an early age, people developing heart attacks, and they're dying suddenly. Number of deaths are increasing from many cancers. So this is because one of the reasons is the tobacco, along with many other reasons of environmental pollutions. So what's most disheartening is to see young people becoming easy prey to tobacco. We see many college children starting smoking and carrying on this habit throughout their life. So we should educate our children not to pick up this habit. Even if they are picked up, they should stop this and move on and quit this habit. What we dream of India to be, we dream to create a smoke-free and tobacco-free India. We have to educate every person possible on harmful effects of smoking and tobacco. We have to raise our voice against passive smoking, help people quit smoking and tobacco. So everyone who is joining this webcast is requested to do their bit for tobacco cessation and make our country a greater country. स्वस्थ भारत बनाने में योगदान दें, धूम्रपान ना करें. We should see that we don't use tobacco. If we are using, we should stop it. And those people who are using it, we should motivate them to stop use tobacco. So with this,